Thank you for joining us. My name is Janelle Hahn. I am the Executive Director for your local American Lung Association here in Central Florida. I'm here with a few of my friends in celebration of National Women's Lung Health Week and Lung Force. We all have a little bit of a touch of turquoise on today as we celebrate Turquoise Tuesday. But we're here today to talk about some important issues around women's lung health and lung cancer. So joining me today, I have Jill Carvara and Dashi Haynes from the AdventHealth Cancer Institute, as well as Hannah Cohn from the Lung Transplant Institute. So we are very excited to be here, and let's go ahead and dive on into it. So we're talking about National Women's Lung Health Week and the importance of Lung Force. This is about raising awareness for women's lung health and lung cancer, knowing that lung cancer is the #1 cancer killer of both men and women in the United States, has been since 1987. We know it takes more lives than breast, colon, and prostate cancers combined. So, let's talk. I'm going to direct this to you ladies with the Cancer Institute. We run into so many issues with our constituents, especially when they find the Lung Association, where they say, I had no idea I had lung cancer. A lot of times it's not until it spread to another organ in their body. So let's talk about, for women and for men as well, we know that lung cancer can be silent in the beginning, but can you talk to us maybe about what are some of those risk factors that people should be looking for lung cancer?
For lung cancer, some of the risk factors include having a smoking history. Even if an individual has quit smoking years ago, so sometimes we call it like a remote smoking history. Someone may say, yes, I used to smoke, however, I quit over 20 years ago. And that's good that they quit, but it still places them at a higher risk for developing lung cancer. Some of the other factors include a family history, such as maybe a mother or brother that had been diagnosed with lung cancer. Also exposure to some chemicals, such as asbestos. We get calls about that, about radon and other carcinogens that could lead to developing lung cancer. An additional risk factor could be individuals that have had a previous cancer history, such as breast cancer or a lymphoma, where they may have received radiation to the chest area.
Fantastic. That's all really good to hear. And I want to circle back just quickly as a little PSA around radon, that people don't realize that that is actually the second leading cause of lung cancer in the United States. And even here in Florida, we do need to test our homes for radon. And actually, if you contact either the American Lung Association or the Department of Health, you can actually get a free radon testing kit for your home. And that's a great way to prevent a very terrible disease. So, knowing what some of these risk factors are, we know that recently there were some changes in the screening guidelines around lung cancer. Can you all talk to us a little bit about that?
I know there are some changes that are currently being proposed, but nothing finalized just yet by CMS. So currently, the guidelines for lung cancer screening, you're looking at a person's age, which right now is women or men between the ages of 55 to 77 years old. And then there's a calculation of a patient's smoking history. So they must be someone who's considered a 30-pack year smoker or more. And the way that we calculate that, or the easiest way, is we tell patients a heavy smoker is defined as someone who may have smoked a pack of cigarettes a day for about 30 years, or someone who may have smoked 2 packs of cigarettes a day for 15 years would equate to a 30-pack smoking history. If the patients have quit smoking, it must have been within the last 15 years. So sometimes we may get individuals who say, I quit smoking 25 years ago. Even though they may have a 50-pack year smoking history, they unfortunately will not meet criteria for the screening test because they quit more than 15 years ago. So Some of the other criteria include they must not have any symptoms of cancer, such as unexplained weight loss, a worsening cough, shortness of breath, or coughing up any blood. So these are questions that we ask patients to vet them to make sure that they are appropriate for the screening test. Now, should a patient say, you know what, I have been losing weight, I'm not dieting, or I do notice that when I cough, I'm seeing a tinge of blood, then we reach out to the provider to say, this patient isn't appropriate for a screening, but you may want to do an additional diagnostic workup, such as a regular CAT scan.
Wonderful. And I know one of the more, I think one of the challenging pieces when it comes to screening is understanding that smoking history. And we're going to talk a little bit more about smoking history and non-smokers developing lung cancer, but the American Lung Association also offers a tool called Saved by the Scan. And as a patient, we can go into that and do a self-assessment, and it'll help you do that calculation for you. And that's something that you can take to your primary care provider to say, hey, I took a quiz and I think I might be eligible. Yeah, one other little thing to address too is I know sometimes when, as a patient talking to my healthcare provider, I may downplay some of my social habits. I only drink 1 or 2 glasses of wine a week. I quit smoking so many years ago. I'm not a crazy vitamin lady, right? So maybe another message in all this too is, to really be honest about your social habits, right?
We definitely encounter that, I think both, as we vet patients. I think smoking carries with it a stigma. And once you start talking to patients, they may say, oh my gosh, I started smoking when I was 12. Or no, I haven't quit smoking yet. Or I have decreased. So we do have to dig a little, and it's always a phrase that I kind of use and say, if they tell me, well, I'm trying, and I say, well, that's great that you're trying. If someone says, well, I'm a former smoker, great. How long ago, did you quit? And then you're kind of guiding them to say, based on your smoking history, I understand that you told me right now you only smoke 5 cigarettes. Has it always been that quantity? And then you really hear, no, in the beginning I was at 2 packs per day. Because you really don't want someone that really meets criteria not to be able to have this screening tool. Because as you mentioned, it's so important to catch lung cancer in its earlier stages. And a lot of times patients will downplay and say, no, I've only smoked for 10 years. And they may be 70 years old. So then I say, okay, so did you start at age 60? No, I started when I was 18. Did you have a point in time where you may have quit for a year or more? Oh, of course, I didn't smoke when I was having my kids. But then, throughout the rest of my adulthood, I did. So we help them to calculate it. And our goal is to get as many people that qualifies for the test to have the exam so that they know for themselves if there is any abnormality, how to continue that follow-up with their physicians.
Wonderful. It definitely sounds like it is a judgment-free zone, and it's all about being honest with your provider.
Yes.
So let's get into a little bit of men versus women developing lung cancer, right? So we're seeing the statistics showing us that a lot of women more recently seem to be developing lung cancer. Can we talk about why are we seeing these trends?
We are seeing an increase in a trend of women developing lung cancer. It seems to be a case of maybe these women aren't really, they're busy in the caregiver role, but maybe they're not paying attention to some of the things that they may be feeling, maybe not following up appropriately as caregivers, taking care of their family, ensuring that they're okay. But we are seeing that increase in women developing lung cancer. Men are still leading, but the gap is closing.
So important for women to really take ownership of their health, talk to their primary care providers, and be their own advocate in all of this as well. So, we talked a lot about, especially with Saved by the Scan and with the current screening guidelines, is really driven around smoking habits. But, do you only have to be a smoker in order to get lung cancer?
No, we're actually seeing that currently 2/3 of cancer diagnoses are actually non-smokers. So it is definitely a disease that can happen in non-smokers. So it's important for everyone to be vigilant, pay attention to your body, be your own advocate.
Absolutely. Now, we are filming this in the week of Turquoise Takeover and National Women's Lung Health Week, and this is going to be airing on Turquoise Tuesday. And why? Can you guys talk about why that's significant here at AdventHealth?
I think it's very significant, as Jill pointed out. As women, we're constantly multitasking. We are busy, whether you're caring for a parent, a spouse, or your dependents. And a lot of times we neglect to put our own health first. And we have to kind of lean to that model. If I'm not taking care of myself, who else will? You cannot effectively care for your loved ones if you're not in your best top shape. And I know for a lot of women, they may look at breast cancer as something that they need to be vigilant about and getting their mammogram. So it's our hope that they also pay attention if they have a cough, if they're losing weight. And I know we all want to lose weight, but we want to make sure that we're doing it in a healthy manner. And if your body is telling you, hey, this doesn't feel right, it's okay just to get a checkout, just to be sure.
Exactly. So be on the lookout on Turquoise Tuesday for the Ginsburg Tower and the Women's Hospital here at the main campus to be illuminated in turquoise in honor of National Women's Lung Health Week. Now, for anybody interested in connecting with you all for maybe further questions with the Cancer Institute, what is the best way for them to find you?
The best way for them to find us is to reach out to our department, which is AdventHealth Oncology Support and Education. Our office phone number is 407-303-5999. That is where the team of oncology nurse navigators rest, and we can get you connected with whatever tumor site is needed.
Wonderful. Thank you so much, ladies. And I know I've had such an awesome opportunity over quite a few years to work with you all in the Navigator team through our Lung Force Expos and through Lung Force as it has really driven this conversation over the last 7 years. So if you all have questions, definitely please reach out to our friends at the Cancer Institute. And literally right across the street, we talk, the lungs are absolutely amazing. And going into the cancer side is fascinating, but also transplant is super fascinating as well. So we know a lot of questions will come up over the years of, can a cancer patient get a transplant, or what other factors have to happen in order for a transplant to happen? So can you talk a little bit, Hannah, about some of the typical conditions that you see with people coming to you looking for a lung transplant?
Sure. So we see a wide range of patients with all different kinds of lung diseases that come to see us and are referred to us. So some common lung diseases that we see can be patients with COPD, pulmonary fibrosis, cystic fibrosis, pulmonary hypertension. We do sometimes see patients that also have a history of lung cancer as well. With cancers, our patients have to meet certain criteria and also to be cancer-free for a period of time. It's important for that because our patients after transplant are on immunosuppressant medicines. So we want to make sure that they've been able to stay cancer-free for a certain period of time and also don't have any active cancer present when we transplant them due to being on those medicines. But the other thing with a lung transplant is we always want to make sure that patients with an advanced end-stage lung disease have exhausted any other medical or surgical options that might be available for their lung disease before we move to lung transplant. So usually our patient population is referred to us by their primary pulmonologist, who have already tried all of those other interventions and have referred the patients to us to then see if they're a candidate for a lung transplant and if it's the proper timing to look into the transplant process.
Wonderful. I know lung transplants are definitely really complicated. It's such an interesting topic. For anybody who's watching, check back on our April lung chat that we had with Dr. Zishan with the Transplant Institute, where we really got into some of the nitty-gritty around transplants. But we won't go that deep today. But if somebody did have the opportunity for a lung transplant, I know there's a lot of mystery around what does recovery look like. I think from the general public, sometimes they think you must be laid up in bed for months and life is totally different for you, but I think I've heard otherwise, where it's actually kind of an interesting process of getting back on your feet. So what does the recovery look like for a lung transplant patient?
Sure. So it's definitely hard work, but we have a team of people that work with our patients, all of us at the Transplant Institute, to kind of help them go through that process. So it is a lot of hard work up front and a lot of hard work afterwards as well. So after the transplant, you know, we do try to get our patients up and out of bed and moving as quickly as possible. So as early as the next day after the transplant surgery, getting them up out of the bed, walking and moving. Our patients that really are strong and ambulate have the best outcomes. So we really, really push that. We push the rehabbing before and after the transplant. And with the lung transplant, we always try to teach our patients it's like trading one disease for another. So unfortunately, it's not exactly like a cure because there is a lot of hard work that goes into it afterwards with, you know, trying to treat and prevent infections, treat and prevent rejections, new medicines, different lifestyle changes our patients have to make. So it is a big lifestyle change, but with all of that said and done, our patients do get into a new routine, a new normal, and they're able to do these things that they love to do again. Of course, pre-COVID, we had a lot of our patients that they were able to go back and, you know, go on cruises, go and see their families. We have patients run marathons, swim, all these things that they love to do that maybe they couldn't do before. So our goal with giving patients lung transplants and doing our job is to help our patients get a better quality of life than they had before.
Absolutely. I know pre-COVID, so the American Lung Association offers what are called Better Breathers Clubs, and many of those actually exist on AdventHealth campuses throughout Central Florida. We've had a number of people who come to the Better Breathers Club who are transplant recipients and are actually really great role models to people who are really dealing in the throes of severe COPD, severe IPF, and have amazing stories about how they could barely get out of bed before, and now they are walking 5 miles a day, they're able to sing again, or just little things that really make a difference. So obviously with COVID, Better Breathers Clubs have gone virtual for now, but we're really looking forward to the day that we're back in person. We can hear some of those amazing success stories from some of these patients coming out of the Transplant Institute. So now, you know, what is your role with somebody going into the transplant program? What do you do? Tell me more.
So I'm a lung transplant coordinator, so we're RNs, registered nurses. We divide it in our group by certain coordinators that take care of patients before transplant, so the point in which they're referred to us from their primary pulmonologist, all the way up into the point where they're transplanted. So we take care of them throughout that referral phase, the evaluation phase, so evaluating them to see if they're a candidate. And then if we do move forward with listing them or putting them on the wait list, meaning they can start getting organ offers for transplant at that time, we also help to manage them at that point. Now, when a patient's transplanted, they're then followed by a post-transplant coordinator from that point on for the rest of their life afterwards. So as coordinators, we kind of assist patients in being the liaison between them and our team and vice versa. So we help with a lot of education, make sure that they're getting all their testing and diagnostics needed throughout the process, explaining those different items that they're getting to them. If we do need to do further testing, we're helping to explain that to the patient as well. And like I said before, we work as a multidisciplinary team. So there's a bunch of us that make up a team, so we have a lot of different components to assist our patients, and we kind of help to coordinate all of that together and to be available for our patients for their needs and questions.
Wonderful. Yeah, something that you just said that I think also would be really relevant with the Cancer Institute too is the lifelong journey together. That you have these new lungs or a new organ. It's a lifelong journey together, as it is with the Cancer Institute, where life has really changed from that moment forward. But it sounds like on every aspect of who we've talked to that there's an amazing team behind every single patient. So now, for anybody with questions for the Transplant Institute or questions for you, what's the best way for them to find out more information?
Sure. So we do have a website. The AdventHealth Transplant Institute is a great website to go to find more information about our specific program at our hospital. UNOS, which is the United Network of Organ Sharing, they're kind of our governing body over transplant. They're a great resource to go to as well if you want general information on lung transplant. Or you can also call our office if you want to get information on how to possibly be referred to our program. Our office phone number is 407-303-2474, and then we can assist you with that referral process as well.
Awesome. Well, this was really fantastic information today, so I want to say thank you to Hannah, to Dashi, and to Jill for all of this fantastic information. Ladies, is there anything else that we didn't cover that we should today?
I think so. Thank you for having us.
Yeah, thank you very much.
No, thank you. So check back next month in June for our next lung chat. But in the meantime, make sure to throw on some turquoise to celebrate National Women's Lung Health Week and to raise awareness around women's lung cancer issues. Again, I'm Janelle Hahn, your local executive director for your American Lung Association, and thank you for being here.